Hey guys, I'm Dr. Gary Linkov of City Facial Plastics here in Manhattan, and I'm a facial plastic surgeon and a hair restoration surgeon.
Hey guys, how are you? It's Courtney Hall, and today I'm at Dr. Gary Linkov's office on Madison Avenue and 59th. I'm so excited. It's such a beautiful spot. He is so informative, and he has told me so much about what I may need, what I don't need. Surprisingly, he told me I don't need most things, and that a little Botox is really all I need right now, 45. So I'm excited to be here. He's amazing, the staff's amazing, and I'm going to show you the results ASAP.
So we're just talking about the effects of Botox and sort of where to place it and how to properly target it. So we're looking at the forehead, and yes, there are definitely some horizontal lines. And one mistake that I find a lot of injectors make is that they're only injecting in the medial aspect, so the central aspect. So this is where you're kind of seeing lines, right? So there's a temptation, especially on this side, to say, well, I'm just going to make my injections right here, and maybe a little bit here because that's where the lines are. But that's not understanding the underlying anatomy and where the muscle lives. Right. So if you do that, what's going to happen is this eyebrow is going to arch up, right? Because this area is kind of uninhibited, and so this muscle is still working, and so that's going to cause the lateral aspect of the brow to rise up.
Okay.
So what I'm trying to say is that we're going to inject across the entire forehead where the frontalis, which is the muscle that we're working on, lives.
Okay.
And that's going to give you a much more natural result, and we're not going to go too low so that the eyebrows don't start to sag and get heavy.
Exactly.
And then we're also going to target the area in between the eyebrows that's called the glabella, exactly these lines, but again, we're targeting this muscle. This is the corrugator muscle coming in.
Okay.
And some patients have a pretty prominent what's called procerus muscle, and that gives you like one solid horizontal line here. You don't have a bad case of that, so
Thank goodness.
Yeah, so I'm going to avoid injecting there.
What do you think about here?
Yeah, so smile for me.
I feel like that is, it makes me cold.
Yeah, I think for sure that you'd benefit from, and relax your face, I think you'd benefit from some crow's feet injections. But one thing to keep in mind is that you have some lines that are just there, right? Some of these lines they're already etched in. So the Botox isn't necessarily going to get rid of those lines.
Okay.
So that's just something to keep in mind, that to get rid of these fine lines, usually laser resurfacing, such as like CO2,
Okay.
can really help. But the Botox will still help
Okay.
with the dynamic wrinkles. Okay.
Perfect.
So, but otherwise things look good. I'm just looking right, and then I do a lot of upper lip lift surgery. So,
Okay.
so just kind of looking at that. Your philtrum, it really isn't long. I mean, we could measure it to be exact,
Okay.
but approximately it looks like at about 15 millimeters, which is totally within norm, within a good range for you. And then so you have essentially 4 of your upper teeth that are visible. And that's great. That's a lot of times the goal for the lip lift.
Really?
Is to bring those upper teeth out, because a lot of times people are opening their mouth and only the lower teeth are visible, and that's like a less youthful, less kind of sensual look. So what you have is good. But yeah, and then so a couple of small things. So there's like a few little fine lines coming in, vertical lines.
I noticed that.
So people ask, well, what can you do about that? One thing I don't like to do is to inject filler into each line. I find that creates a very artificial look. The filler migrates in that area called the philtrum, and I do surgery in that area, so I've seen sort of bad results of the filler injections there, and it also tends to create the swelling. So that's not the answer. So what can you do? Chemical peel or laser resurfacing.
Okay.
And so those are some of the big things that really can help rejuvenate that area and just create like smoother skin.
Okay.
A lot of times people combine that with sort of the rest of the face when they're doing resurfacing. And
I've never done that before. All right, I'll look into it.
Yeah, and one of the other things to look for, people ask, well, when do I know if like a facelift is right for me, right? People always want to know, like sort of like, as if there's a magic kind of, there's no magic age, right? Some people will age faster than others, and but one thing I look for, and one thing everyone can look for, is these lines. So lines that form in here are called the marionette lines, and then this one is the nasolabial fold. So the NLF we call nasolabial fold, and then the marionette line down here. And you really don't have much of a marionette line. You have very slight, I would say normal level of depth of your nasolabial fold. Obliterating this line is foolish in many ways. because it's normally there. So we tend to sometimes over focus as a community on the nasolabial fold, but it actually is okay to preserve it to some degree.
Okay.
So what to look for is when those lines get deeper, what that is saying is that the cheek complex is starting to fall in. So it goes in and down. So the jowls, which you don't have, I'm just pointing out where it would be.
Mm-hmm.
The jowls start to form because you have this kind of, marionette line. You have a ligament here, and the cheek basically can't go any more forward. So it starts to fall down, and so that's when you get that jowling. So lines forming, jowling, deepening of this crease here. Those are all signs, and obviously when the neck starts to get more full.
Yeah.
Those are signs of, probably a person being a good facelift candidate at that point. So in your case, you're not a good candidate. Sure, so we're just prepping the area, so removing essentially the makeup so that it's a little cleaner for our injection.